Hey everyone, this is Carrie Anderson. Hope you all doing well. In today's video, I will talk about herbs for diabetes. So, if you like the video related to my health my way, I would like to request you all please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So, here we begin. Let's go. So, some drugs for diabetes can have dangerous side effect. In a striking example, on March 21st, 2019, the US Food and Drug Administration removed one of the most widely prescribed diabetes drugs, that is Rezulin, from the market after it was linked to 90 cases of liver failure and 63 deaths. Already concerned about such problems 2 years ago, the Aptos Caliph resident began taking sweet as a mixture of herb and minerals sold for diabetes. The supplement seemed to work wonders for the self-described old hippie. So his level of glycosylated hemoglobin, a protein that reflects blood glucose levels over the past 2 to 3 months, plummeted from 11 to well below the danger 3 threshold of 6. I feel great, says Scott Hingham, who has experienced no side effect from the supplement. I'm completely off diabetes medications now. A success story, perhaps, but expert advice caution. For one thing, because sweet as it contains 16 different ingredients, and because the severity of diabetes symptoms can fluctuate on their own, it's hard to say what exactly is responsible for Cottingham improvement. For another supplement, carry their own risk. Some products don't contain the ingredient listed on the label. Others come mixed in with dangerous and unlisted ingredient, and scientists are just beginning to verify which one actually work. So, doing ginseng justice, one herb touted for diabetes got a boost recently from a Canadian clinical trial. University of Toronto researcher Vladimir Wolskin, PhD, announced at the American Diabetes Association annual meeting in June 2019 that he had gotten some positive results using ginseng. In addition to their usual diabetes regime, a careful diet, regular exercise, and in some cases, medication, 23 type 2 diabetic patient took either 3 grams of American ginseng or a placebo each day for 8 weeks, at which point they switched treatment. The diabetic patient fasting blood sugar level dropped about 9% more when they took ginseng compared with when they took the placebo. Glycosylated hemoglobin level between the two groups differed by 4%, with the ginseng group being lower. Despite these encouraging results, Wilson caution that it's too early for diabetic patients to rely on ginseng. Herbs sold in this country are not standardized, he says, so it's difficult to know for certain what you are buying and impossible to ensure consistent dosages. Besides, his study looked only at American ginseng, and he's not certain the result would hold true for the 7 other varieties. What's more, researchers haven't conclusively identified ginseng active ingredients. So the fenugreek findings. Meanwhile, other scientists are studying fenugreek seed, a folk remedy for diabetes. Several studies, including one published in 2018 in the European Journal of Clinical Nutrition, suggest that this herb can lower blood sugar. Researchers found that type 1 diabetic who took 50 grams of fenugreek seed powder twice daily had significantly lower blood sugar level than those who took a placebo. Little is known about how other herbs might help control diabetes. Stevia and bilberry have been studied in animal experiments but have yet to undergo large, controlled human studies. So the reputation of 2 other herbs, gymnome and jambul, rests on anecdotal evidence alone. The ADA steers people away from herbal remedies together. The regulation of herb is not very good, says Anna Daly, MSRE, a diabetes educator with the organization, and we can't be sure that all supplements are equivalent. Some herbal diabetes products have turned out to be downright dangerous. In February 2018, the FDA recalled 5 Chinese herbal products after discovering that they contain various amounts of 2 prescription diabetes drugs, fenformin and glyburide. Fenformin was withdrawn from the US market 20 years ago after it caused serious side effects, including several deaths. So given these uncertainties, some people are turning to mineral supplement instead of herb, one that shows great promise. Chromium is a trace element that seems to help insulin work properly. So the chromium contribution, US Department of Agriculture scientist Richard Anderson, PhD, reviewed the research on the mineral for a 2018 article in the Journal of the American College of Nutrition was found at least 25 studies suggesting that it can benefit diabetes patient. It's not a panacea, he says, but because chromium supplements seem safe at the doses most commonly recommended, he believes that there is no harm in trying them. He recommends starting with 200 micrograms of chromium 3 times per day and then reducing the dose to twice per day if blood sugar level improve. Other researchers have focused on magnesium, noting that people with diabetes have lower than normal level of this mineral, but there's little evidence that consuming more magnesium helps treat the disease. So, and the ADA advises against taking any mineral supplement for diabetes. If you eat the kind of balanced diet you are supposed to, then supplements are not necessary, says Daly. If you do decide to try herbal minerals, the best strategy is to get your doctor's help in balancing them with your medication. Most important, be honest with your doctor about the supplement you are taking. If you can, bring the supplement container with you or on your next visit. So Cottingham did just that. He enlisted his doctor's help in deciding how to cut back on his medication, and the supplement apparently brought his blood sugar level under control. The doctor said, I can't recommend this stuff, but if I were you, I wouldn't stop, says Cottingham. So that's all about the diabetes herb for diabetes type 1 and type 2. So that's all I would like to mention here, which is very important for you. I personally prepared a small presentation for all of you guys. I will be going to drop down the link in the description box below. You can check it out from there, and I'm sure that will be going to help you in order to reduce or overcome your diabetes. So that's all. I would like to request you all, please do like, share, subscribe this video with your loved ones so that they can also gain their knowledge about this. So before leaving out, I would like to congratulate that you will be soon overcome the diabetes, so you don't need to worry about it. So I will definitely come up and meet you all in the next video with my other content. Till then, God bless you all. Have a lovely time with your loved ones. Bye bye. Take care.